Good morning.
Good morning.
Hi. I'd like to welcome Professor Carolyn Arnason this morning, and we're going to talk about music therapy.
Sounds good.
Yeah. So, Carolyn, tell us a little bit about this new discipline that's being offered.
Oh, well, where to start? It's interesting that music therapy is still called new, because, I guess it's relatively new as a profession in Canada, but it's been taught as a profession in Canada since the mid-70s.
Okay.
And so that's kind of the profession part of it. To work with music as therapeutically, it's been around for many
Eons.
eons. Yeah.
Right.
Yeah.
But music therapy itself as an academic discipline is fairly new.
It's fairly new in Canada, mid-70s, as a
Right.
discipline where people could go and study to become a music therapist. In the States, it's not quite as new. Early 50s is when the first programs began.
I see. Yeah, the thing is that when you started out on this, you obviously were interested in music. So how did it begin for you? Were you a musician?
Yeah.
And then you were more interested in certain aspects of the music?
Yeah. I've been a musician probably further back than I can remember. My sister Debbie and I started piano lessons with our mother. I must have been about 4. And so I don't even remember learning how to read music. It's that far back in my life. So I've been a musician and still am a musician for many, many years.
Right.
It just, when I was in my mid-30s, and, a lot of us are, there's something else that we want to do with our lives. There's like a calling, although it wasn't really, it didn't sort of come in a blinding flash of light, but it was, I wanted to go back to school. I wanted to do graduate studies in something.
Right.
And I had done piano performance. I had done that, and I didn't want to go further in that. And the idea of music therapy, of working with people and using music to interact with them, that was a fascinating idea. So I was a late bloomer into music therapy. I was in my mid-30s when I came to study it.
And so you're now a professor of that.
I am at Wilfrid Laurier University in Ontario.
Now, is that one of the few places in Canada, or is that?
There are about 6 programs now.
Oh, there are.
Yeah, there are 2 in Ontario.
Right.
And until a couple of years ago, Wilfrid Laurier was the only university that had a graduate program in music therapy.
Right.
But there's there's an addition in Canada, and that's at Concordia University in Montreal.
Okay.
Yeah.
And so
there is a music therapy program right here in Winnipeg at the Mennonite University. That's the newest one in Canada.
Well, it sounds like it's something that's starting to become accepted and sought after as a means of therapy. But when we talk music therapy, what exactly does that involve?
Well, that's a big question. Music therapy, there's so many ways that people practice as a music therapist.
Right.
Different theories, different philosophies. But I'll speak from the way I practice, which is what I would call improvisational music therapy. So when I'm working with clients, I am improvising music. I am creating music based on their responses. So I could back up a minute. There is the whole process of assessment. So, if you go to a doctor, you go to a psychologist, there's that assessment where I'm trying to get to know someone. What are their strengths?
Okay.
What are the areas that need some work? And so that is the beginning. But I'm doing that with music as well as my words. I mean, if I'm working with someone that can speak to me, then I would be working verbally as well.
So it's interesting. It's almost musical psychoanalysis.
Yeah.
Wow.
I mean, I said that my approach was improvisational music therapy, but I could also surround that with music psychotherapy as well. So it is a depth approach. I'm very simply put it, I'm working with someone's inner life as well as my own, because the relationship is very important in music therapy. But I just want to say it's a relationship through and in music as well as nonverbal and using words.
It's very interesting when you think of it, that so someone has some kind of dysfunction, and they come to a music therapist, as they would go to a psychiatrist or a psychologist, and instead of talking to them, you play music, which is kind of an interesting pathway to kind of address the issues that may be there.
Yeah, it's music, and keeping in mind that using the word music, it's so huge. It's like this huge idea, because there are so many different kinds of music.
Okay.
But just to stay with that term music, I think I lost my point here.
It's a huge area.
Yeah.
In terms of music.
I could maybe use an example. I mean, I think what I'm beginning to describe is my own journey as a music therapist. And so if I backed up a little bit with my influences, when I first came into music therapy, I was being educated, and I much prefer the word education than training. I was being educated in what's called a behavioral approach, where I'm working with just really visible behaviors and trying to change those. And that way of working, the whole behaviorism theory and working behaviorally, I mean, I was taught that, I did that because I was a student, but it never really went in, it never felt authentic for me as a person.
Okay.
Yeah. And then I, as the years went by and I worked with clients, and I teach music therapy students, and I teach improvisation, and in music therapy we call it clinical improvisation. So I'm teaching students how to bring music to their clients.
Okay.
So then it was a more improvisational approach. So to use a concrete example, I don't use a lot of what we call pre-composed music in my sessions, like songs. However, I do. If that, if there's a song that's very meaningful to someone, I'll work with that. But that's an approach to music therapy that's really song-based, and I don't work so much in that. So I'm creating music in the moment with someone else. Then kind of another step started about 4 years ago, where I started doing training, and it's called guided imagery in music, or the Bonnie method of guided imagery in music.
Okay.
And that is the music psychotherapy piece. So that is, it's further training in how to depth with someone, and that's where I am right now. So you can see where I started kind of with the surface of things, what somebody's doing, what a child is doing, and it's getting them in trouble, and how to change that behavior. And then we're moving more into using music improvisation and working in the moment with the child, and also being interested not only in what I'm seeing, but why is something happening? So what's going on inside the person?
Right, exactly. I was just thinking that when you were talking about adjusting behavior, but does that really get to the root of why the behavior happens in the first place? And how does music, how can music reach that?
Well, that's a good question. I certainly don't have all the answers to that question, but based on my own experience, music has, I mean, just the character of music, it's fluid. It's much more fluid than words. I mean, one of the ideas that I think of often with music is it gets in, or it gets behind our intellect. It can get in, and two things about that. In music therapy, we talk a lot about the power of music.
Okay.
And music has power, but with that power comes some responsibility, because if something can come inside someone so easily,
right,
and then they start opening emotionally,
yes,
personally, interpersonally, spiritually,
right,
and when I'm working with that person, I have some responsibility to work with the power, because sometimes
right,
people are not able to do that entirely on their own.
Well,
they become so open that it becomes, well, it can become quite scary. And
well, I believe what you're referring to is that there is a great deal of obligation a therapist has when one is when someone is opening up to them at an essential level, and you don't wish to put anything that's unconscious into the formula when you're that deeply interconnected.
That's interesting. That I don't wish to put anything unconscious.
Yeah, because it seems to me that that's probably the reason certain those characteristics or behaviors are there in the first place, because of some unconscious implantation.
Yeah.
In their essence, if you will.
Yeah. I in my heart, I really believe that was one of the main reasons that I started this training in guided imagery and music, in the music psychotherapy, because what I was finding with myself and also with the people I was working with is, yes, it is the unconscious and conscious, or in guided imagery and music, which I'll shorten that to GIM, we call it GIM, there's a lot of influence from Jung's work, Carl Jung.
Right.
And that whole idea of individuation, which is the coming together of consciousness and unconscious.
I see.
And so that is strongly influencing me now.
Well, yeah.
That working with the unconscious, both myself, because in guided imagery and music, because it's psychotherapy, I'm taking myself through my own process personally.
Right.
And then also working with clients.
When you get into those spaces with your clients, whatever the situation is, obviously people are coming to you because they wish to be helped in some way with their psychological or even deeper problems, and so when you as a therapist are present in those spaces, do you somehow maintain a role of impartiality in terms of what's going on? Do you sort of become kind of an objective observer to the process so that you don't get subjectively involved in it yourself?
Yeah. Well, no. It's a simple answer. Philosophically, myself, I don't believe that as human beings we can be objective. And when I'm working with someone, I guess the way that I would put it is that it's important for me to know where my point of grounding is. Where is my center?
Right.
And in a guided imagery and music session where a person is in an altered state of consciousness, I could describe how a session goes, so you get some information about that, but I need to be there, present. You use the word present. I need to be present with the person, and I also need to make sure that I'm not completely in that.
Yeah, because, there.
Yeah, because that,
situation.
You know, it's complicated because there are times where the person is very deep in their process and I'm right there with them.
Okay.
But I need to be able to find where my grounding is. And a lot of that learning has come, like I'm learning how to use my voice.
Mm-hmm.
Because in a GIM session, when the person is traveling in their imagery, it's my voice that they're hearing, because sometimes I ask questions.
So
like,
you're kind of anchoring them to a real center.
How is that, or what are you experiencing now? If they've gone silent and I'm not quite sure where they are, then I need to check in without interrupting.
Right.
So I would put the impartiality and objectivity, I would rephrase that to a grounding, and where is that in me?
I think that's what I meant.
Yeah, and sometimes it can be intense. And so it is a use of my body as well. So sometimes if I'm working with someone, I'll need to adjust my body just to kind of check where my feet are. I've actually talked to some GIM therapists that if it's getting really intense, like if they're working with someone that has trauma issues, experiences, that they'll actually have an object, the therapist has an object like a stone or a shell that has a bit of an edge on it.
Right.
Because it isn't embodied, it's funny because altered states of consciousness, I mean, the person can be quite out of their body, but the therapist needs to be in their body.
Right, to stay grounded.
Yeah, because
not to get taken off into the out-of-body situation.
Because the other thing that's happening in guided imagery and music sessions is that, like I talked earlier about improvising, but in GIM I'm actually using recorded music.
Oh, okay.
And they're particular music programs that are put together for different issues that people might need to work on. So the point I'm trying to make is that in my personal sessions, I have also listened to that music.
All right.
So that gives me an intimate knowledge of that music, but it can also be difficult sometimes when I'm working with a client, because what they're experiencing in that music is not necessarily my experience.
Right, and so I guess that would be the key, in a sense, is to establish a form of music that is more or less objective, even though you say it doesn't. Maybe it's not absolutely possible, but I mean something that would affect someone in the same way, regardless of the situation. You or the client or anyone else. Right. And so is that part, or is that some of the aim of this kind of music? It's not just, I feel good with that music, but someone might not feel good hearing the same piece. So is it to establish at least a general kind of field where they can rest in, and it would happen
if rest is what they're looking for. And maybe I'll just give a little bit of detail about what it, and this is the Bonnie method of guided imagery and music. And the Bonnie method, the Bonnie method of guided imagery and music is one of the main approaches in music therapy.
B-O-N-N-I-E?
B-O-N-N-Y.
Yeah.
Helen Bonnie she just recently died. She was an American music therapist. She was a classically educated violinist.
Okay.
And she, in the 60s, got involved in music and LSD research.
Okay.
Fascinating research. And they were working with people who had addictions and major mental health issues. I mean, now it's like, oh boy, that's a little tricky.
It's tricky for it to be accepted.
Yes,
but not that it wasn't a powerful.
It was very
path.
Powerful. The thing is that these sessions, would go on for 6 hours. They were long. And things were changing, like with ethics boards. They were already starting to change, with LSD. And Helen was finding that the music itself, and they were using classical music, like Western art music, classical music.
Right.
She was seeing that the music itself had powerful effects. And what she was beginning to wonder, if you removed the drugs and worked with the music, what would that be like?
Right.
And then the world changed, and you couldn't get LSD research past an ethics board. And so she began to experiment with putting together different selections of music. And she knew music very well because she was an orchestral player. So she knew the repertoire. And for example, one of the music programs is, it's called Explorations.
Okay.
So the musical selections on that program is a variety of music, and that would be a program that I might use with a client in the first session, because I don't know how they image.
Okay.
I'm beginning to build that relationship, so it gives them a variety of music, and then I can begin to assess what are their responses to different kinds of music.
Right. So when you say image, are you saying that, okay, you'll play a certain piece, and then this will evoke something in the listener?
Yeah.
That
Imagery.
And so there are specific types of music that you would hope, I guess, will release certain types of imaging, or
I can never know. Okay, so here's the art of the work.
Okay.
And therapy is an art.
Right. It's not just.
Yeah. So if I could give an example, if I'd had a few sessions with someone, and I had an idea of what was coming out of their imagery, perhaps. Just trying to think of an example. Okay, let's say that it's become clear that they're working on grief loss.
All right.
Okay.
All right.
All right. And there is a music program called Grieving. I might or might not use that.
Okay.
All right. Because grief loss, is that what they're needing to work on? Or
the counterbalance to it.
Or is there some anger in there somewhere? And there are music programs that the music is stronger and it could support and contain if someone has something that they really need to express. Okay. So I'm having to make these very fine-tuned decisions of which music to use. Because if I'm detecting some anger in someone, but it's not actually right there, then I might have made a mistake by putting on some strong music. Because the thing with strong emotions, is actually if they're not right there, maybe that is not the time to work on them.
Right.
It's very delicate.
Well,
decision making right in the moment.
Well, it's almost more like it's a qualitative empiricism rather than a quantitative.
Oh yeah.
You don't put this much music on at this volume and with this kind of tempo and that kind of theme to necessarily evoke that for everyone.
Yeah, that's right. It's not a sort of it's going to meet everyone at whatever. Like
it's not for everyone.
And the evoking aspect of it, I wouldn't say that's coming from me, although I am making the choice with the music.
Right.
But in GIM, we talk about the music as a co-therapist.
Okay.
And I've lost track of the number of times in a session where I know the person's okay, I know where they are in their imagery, and I don't say anything, and I let the music do its work.
So you're actually, when you say you know where they are in their imagery, are you sort of almost empathically connected to them, that you can feel?
Well, I've asked them. I sometimes I know as concretely as I know what kind of scene they're in.
Mm-hmm.
I know who's there. I know the colors because I've asked.
Mm-hmm.
You know, now imagery can shift very, very quickly.
And what does the imagery have to do with the dysfunction, though?
The imagery, it's the messages from our psyche. It's
Right.
the unconscious.
Or what we're not conscious
You know
of.
what the imagery is sometimes called is waking dreams. It's sometimes called waking dreams. The thing about dream, I'll just kind of shift a little here, but it is connected to your question. The thing about dreams
Right.
is that they are a direct connection to our unconscious. They're about at least that's what I believe. But dreams, now not everyone, some people can dream and remember their dreams very clearly, but
Yes.
dream material tends to
Dissolve.
be ephemeral.
Yes.
Now, how many times have we woken up and, you know, we know in our body that this dream has had this effect on us, but we can't remember the details.
Right.
Images stay because the person is in a conscious state. They're not unconscious. They're in a conscious state,
Mm-hmm.
but they're able to access their unconscious, and it's their imagery.
Or maybe it's not just unconscious, maybe, but it's a deeper level of consciousness that we're not aware of.
Exactly.
Normally.
Yeah.
Or ordinarily.
Yeah. Helen Bonney had this, it's kind of famous in the approach. It's called the cut log. You know, it's like that tree outside that was cut, and you can see all the
right.
circles.
Yeah, right.
When you look at the circles. And right in the middle is ego.
Oh.
So our normal ego state, all right? And then the diagram, the circles ripple out. And she talked about levels of consciousness, which, you know, in a way I like better than conscious, unconscious, because there's so much in consciousness and so much in unconsciousness. So she talked about levels of consciousness.
Mm-hmm.
And so as you go out, you're going, you know, personal, interpersonal, transpersonal,
Mm-hmm.
beyond collective unconscious,
Mm-hmm. Yeah.
to where we don't even know. And she also gives examples of how we can reach some of these states. I mean, sex is one.
Mm-hmm.
Daydreaming. I mean, everybody daydreams. I
Right.
didn't get through. I couldn't have gotten through school without daydreaming. I mean, it was a survival for me. And so, when you're in a GIM session,
Right.
a person can actually be moving very quickly
Mm-hmm.
among those levels of consciousness.
Okay.
And how does that help someone? It's that healing. You know, it's
Okay.
because they're accessing what's inside them, all the different parts of themselves, everything that they've experienced, which I truly, truly believe we hold in our bodies.
Okay.
You know, they can begin to access that, and I guess the end result, the finish line, is some kind of integration, some kind of coming together.
Right. And when you say healing, I just kind of imagined, all these multiple dimensions that we're normally not cognizant of, not conscious of.
Mm-hmm.
And then when they do come into our awareness, there is a sense of oh, so that's part of me. So that's so the integration has to do with this thing you call healing too. That we access more of our wholeness, our completeness, right?
That's right. Yeah. Sometimes there are times where we need to give ourselves what we have not been given, or to come back to something in ourselves that has been pushed aside or buried, damaged, but not beyond repair.
Right. And so I think the human being is very resilient in essence, regardless of how battered and terrible the trip may have been at certain points.
Yeah, I agree. There is a beauty to the human condition. It doesn't always feel beautiful, but there is a beauty to that. Yeah.
So now, when you use the music in just in the standard approach, which is using recorded pieces to bring about, to release the you might say trapped imaging, right? When you use that, certain things happen, but when you actually improvise on the spot, now that must be really getting into the presence that you are experiencing with your client or with the person you're with.
You know, I'm kind of, yes. I'm kind of in an in-between place myself with who I am, not so much who I am, but who I am as a music therapist and how I work as a music therapist, because my past experience has been using a lot of improvisation with clients that don't speak much, so what we would call nonverbal people. And so children with autism, older adults that have some kind of dementia. So as that process goes on, just words are not the way they relate to the world.
Right.
And so there I'm not using my words as much, and so I'm improvising music. Now that, and what I mean by the in-between is I'm in this GIM training, and it does use recorded music. So my in-between is, how do I begin to integrate for myself as an improviser, an improvising music therapist, and also someone that's working as a psychotherapist with recorded music that's powerful music. But how do I start bringing those things together?
Well, this almost evokes that saying, heal thyself. I mean, how can we heal others if we ourselves are not whole in whatever way, whatever capacity we have for that?
And so I'm in that process too. I could give an example where actually improvisation came into a GIM session and I was not doing it. I was witness to it. Very, very quickly, a kind of typical guided imagery and music session. They're about 2 hours long.
Okay.
And so we start out, and I would be talking with you, and how is it going? And if you say fine, you know I'm good.
So what's happening? Oh, nothing.
Yeah. And if you have had previous GIM sessions, that I might ask, is there anything coming from the previous session? Anything that, that was important. So there's a bit of talk.
Right.
Now, usually the talk, it's usually recommended to keep it fairly short.
Okay.
Because we are talking beings, if we can talk.
Right.
And the talk, and then there's that feeling where, the talk is just kind of taking us away from now, the here and now.
Right.
But the talk is important because then I get a sense of maybe what the person wants to work on in the session that day. Do they need rest? Is there some dialoguing they're working on with someone who is no longer in their life, but an important figure? Thank you. All right. Then we move into what's called an induction. And that's a guided visualization.
Okay.
And that's to help them just become concentrated, to get the body ready, not necessarily relax the body. Actually, something I've learned from some of my colleagues that do Tai Chi is that if you say to someone, relax, it's
the opposite.
Okay, like the body starts working to do that. So I would not necessarily say that. They're lying down.
Okay.
And there are different kinds of inductions. I might do an imagery one, a ball of light, might be a color. It might be a physical induction, so stretching, finding a way to stretch different parts of the body.
Okay.
And the whole part of this process is to allow the person, and this whole GIM is an allowing approach.
Right.
To get ready. And then as I'm doing this, I might have in my mind, okay, this music program, I think this will work. Or I might actually be still trying to decide. Right. So there's the presence and a little bit of divided attention because I'm trying to be there for the other person, but then it's like, okay, what music am I going to use? Hope my MacBook works today. Always works. Yay. And then I give the person a linking image. And this is like the bridge that will take them into the music. Now this linking image could be quite broad.
For example?
You're walking along a path.
Mm-hmm.
And this may be a familiar place that you're walking in, or it might be unfamiliar.
Mm.
Now, I might leave it that open. That's pretty open.
Mm-hmm.
If we're later on in the process, I might add a little bit. I don't want to give too many details because it can tend to overload the psyche.
Mm-hmm.
Okay. But I might say, as you're walking along the path, perhaps. Now there's the permission, perhaps.
Yeah.
So the person can take my suggestion or they can follow
their own.
Perhaps there's a gate or a doorway or an archway. So you can begin to get the idea that if the person is a little bit on the threshold of going a little further into something, I'm giving them a little idea.
This is fantastic in a sense, because it kind of reminded me like you're creating almost like a movie soundtrack for someone's inner voyage.
Yes.
It's just like it almost sounded exactly like here's the score.
That's right. It's very much like that. It is an art, and what I'm learning is because I have this improviser person in me that sometimes I've given too many details because my own psyche and everything. Right. Oh, I can do this and I can do that, and I can
that's what I'm
put
saying.
This, and then it's like they're kind of overloaded. And
right. Well, that's why I guess the therapist has to step out of the way.
Exactly. Not get in the way.
And allow the client to
allow them
to do whatever they wish.
Allow them, and again, it depends on the person. I'm working with someone that's working with anxiety.
Mm-hmm.
And in general, especially early on, a little more structure might be needed.
Okay.
So then I might be saying the linking image might be a little less open. Imagine that you're standing on the edge of a meadow.
Okay.
Okay, so then, see, nature scenes, in general, nature scenes are useful because a lot of people respond to nature. But again, this is why the assessment is important, because if I put somebody by water, imagine that you're walking along a stream. Water might have an association or a memory that is quite strong and not always positive.
Right. Well, what about when the imagery is not related to anything in ordinary experience. Where does the therapist go from with that?
Okay, well,
let's say one's out in the void in the middle of nothing, or where there are just unusual or unfamiliar forms.
Yeah. So if I take I'll just the next step is the music begins. And again I will say, and in a moment the music will join you, and some of the things I might say is allow the music to be with you, or the music can be your companion. So then a little bit of suggestion that the music is there.
Is it kind of like almost like an umbilical?
Mm-hmm. Yeah.
It keeps the voyager connected to here.
If that's where they need to be connected. So the music begins.
Right.
Well, people are different, and it also depends. It depends on a lot of things. People are different. Some are, they have their own meditative practice. It's kind of not so strange to them. So they get the idea that this is a dialogue, so they need to speak to me during their imaging.
Okay.
And if the silence goes on a little too long, then my first speaking might be, what are you experiencing? Okay. And then they get the idea that they need to speak. All right. So this is a little strange for some people to speak as they're imaging, but it's very much part of this technique, the GIM. So getting to your question, let's say that someone, I'm thinking of one woman in particular. She's in her early 70s, an incredible woman. Very, very, she was born of the Jewish faith, not a practicing, doesn't practice that. She's a Buddhist. She teaches Tai Chi. She is legally blind, and she travels the world. And she is a force.
Exactly.
So for the learning for me as her therapist is actually helping her maybe stay in a certain place a little longer, not always being going somewhere else, but staying, and
right.
What is there and how is that? She's people image different ways. She's a very visual imager, but also physical. So she has actual physical responses. And I remember one time, the end of the music program, it's a piece by Wagner, and it's the high strings. Right. It's at the end of a music program that's called Peak Experience.
Right.
All right, so there are no low strings. There's no grounding instrumentation. It's up. All right. So with some people, I wouldn't use this program.
Right.
Not early on. And she was out there. Just cosmos. The words can't describe it. She was there. It was wonderful. And then she started having trouble breathing.
Okay.
So the image, she had trouble breathing. She said, there's no air here. All right. So this is where the training is very important. It's like, what? Right. It wasn't frightening to me. When you're really, really present in the moment, you know what to do. You know what that's like?
I know exactly what you're saying.
You know what to do. We had done a breath induction at the beginning of the session.
Okay.
And we're breathing, and then imagine you're breathing as, moving through different parts of the body. I reminded her of the breathing. Remember your breathing.
And to continue
and
breathing.
And that you can breathe in that air that you need, and then you can release that air. And this is the air that nourishes you. I didn't want to say too much because I don't want to get in the way of that imagery. And afterwards, because we talk about what happened, so there's the processing, there's the beginning to integrate the spiritual, emotional, physical mind. Afterwards, she said it was just what she needed, which was a reminder that she has the strength to be in that place and that she can breathe herself in that place.
Right.
So that's just an example of if somebody goes into a void or a really terrifying image. I'm very, very quickly at I would say quite an intuitive level, but an informed intuitive level.
Right.
I'm trying to make decisions because I don't necessarily want to pull the person out of the place. That might be quite arrogant as a therapist to just pull them out, and it actually might not be really good to do.
Yeah, it might be too jarring as well.
But how can I be there, like their umbilical cord?
Exactly.
How can I use my voice? So my voice was very important in that example, like just as an example. You can breathe in that place. It's like that's kind of a whispery voice. Now my voice needed to be grounded. Remember your breathing. All right. So then that's again coming into my center, because actually I might be feeling a little airy in that place too. But I need to be more grounded but still be with her.
Right. Empathize but still grounded. So that,
And I also knew...
set adrift.
Yeah. I mean, this again is getting to know somebody and the relationship, because I knew that this woman, how can I put this? That she'd be all right. That she'd be able to do it. It wouldn't be a huge struggle for her. Like she's quite close to her inner resources, her strength. I mean, she's a strong person. Someone else I might have needed to check in a little more, because it might be just so weird.
Or disorienting.
Really disorienting. Really scary.
Well, that's the point of being the guide. You have to be grounded enough so that you don't get disoriented during all the disorientation.
Right. Yeah. And also, it's knowing the music really, really well. So with that particular music program, I know that and this is part of the training, I know that the music, it ends up there. Some of the programs, the music might actually get up, but then it will come down again, so you get the grounding in the music.
So now when you're saying that, when you're going up and down and in the middle, I mean, are you suggesting that the music will kind of reflexively resonate the person into a certain type of emotional state or a mental state?
It can, but you can't count on it. That's all right. Part of the getting to know the music, when I say up and down, I mean, as a musician, I have analyzed all the music programs myself. We have homework, a lot of homework. And so I'm talking about pitch, like I'm talking about all those musical elements, the intensity of music, dynamics, louds and softs. One of the music programs is a big program. And what I mean by that is it's big music, it's a long program. Some of these longer programs, we're talking 40, 45 minutes of music.
And then people are just listening to this during the session?
Yeah, but they're listening to it in a different state of consciousness. So I just want to come back to my example. A lot of people know the Adagio for strings by Samuel Barber.
Right.
All right. Now, that piece has climaxes.
Right.
So you have this, and then there is that one where it's unison.
Yeah.
All right.
Right.
I'm not going to use a program like that in early sessions. It's too intense.
Yeah, it's a very intense piece.
You know, because in a way, you know, it's getting the person's imagination and psyche kind of practiced and strengthened for these journeys with the music.
So, I mean, when you do the music for a person and you've basically introduced them through your verbal instructions perhaps initially, and then they're lying down but not asleep.
They're not asleep. Sometimes people ask me, though, what happens if I fall asleep? But seldom do people fall asleep.
Well, anyway, so when you've introduced them verbally, guided them verbally, and then allow the music then to carry it on, carry the guidance on, you come back in, right? You check back in.
Yeah, we have a dialogue. The person is speaking their imagery.
Right.
And then the art of it is that if there's silence, well, I'm also observing body. So if the breathing is changing, or sometimes there's a little smile that comes on their face, and then I'll say, what's there? You know, so it's just an invitation
to express that.
Or if they're, you know, sometimes people are really, you know, painting a picture with their body, or I notice that there's a tear. There's tears. What's there? So part of the learning these are verbal interventions. You know, psychotherapy is a lot about verbal interventions. What do you say? But what I say in a GIM session is, it's open and it's inviting and allowing, and also encouraging the dialogue, you know, between what they're experiencing and myself as therapist or guide.
Right.
Yeah.
Because ultimately, I guess that is what you're kind of traveling down an unknown river.
Yes.
And you're going through all the different turns and twists and rapids and whatever.
That's right.
And you're there with your sense of balance and centeredness, keeping it going and not crashing.
Yes, I try. It can also be with someone who's a neophyte imager, like this is really quite new to them. It's like I have information about it and what goes on is in a session, and you know, maybe the person is intrigued enough. They've never done anything like this, but they're intrigued enough to give it a try. Sometimes then my role as guide when they're imaging to the music is to ask more specific questions, like, do you notice any colors? Any colors there? Because they're kind of like, there's a perception that imagery is only visual, and they're not really seeing anything, but they are. So it's a kind of an educative process. So any colors, any figures or shapes. So I might be asking more specific questions like that to help them expand.
About
what is there?
Yeah.
They're just
about
not
scents, about
smells.
Yeah. Or sensations in the body.
Sensations or sensings. Some people are, and I've had this experience many times, like we sense something, but if you asked me to describe it, it's just not in my consciousness at that level yet.
Our ability to communicate.
So I honor that.
Yeah.
Sense that. Anything, you know, so sensing a figure, sensing something, and someone who is not an experienced imager, I might guide them to, is there anywhere in your body you feel that? Now that's a little tricky, because like, huh? Like if someone is just
in your left foot or your
Okay.
in your heart area or
so
in your
is
head.
there anywhere in your body you sense that, feel that? And like they might not actually have the word, but they'll point. So I know maybe it's heart, maybe it's somewhere here. Groin.
Mm-hmm. Right.
It is an experience, and so sometimes I will guide them to their body.
Mm-hmm.
There's the classic therapy question: how does that feel? It can be a question that just completely turns someone off if there's anyone there, but any feeling to that. So you begin to get a sense of how what I say might be different from what a psychiatrist is asking or a verbal psychotherapist.
Right.
So guide is really a key word in this approach.
Right, and so I'm still wondering in terms of, okay, so you've got the recorded music.
Yeah.
And that's a major part of the session, but at the same time when you start to play, would that be on keyboard or piano? Or?
Okay, so music has ended,
right.
And then we have post-talk or postlude or the after.
The prologue?
And
is it the epilogue? Yeah, the epilogue.
Epilogue.
Yeah, the epilogue.
Yeah. And, well, it could be a prologue to their learning, but epilogue in terms of towards the end.
Yeah, right.
Giving them space, giving them time to be wherever they've reached. So not rushing too much. And then at some point, in some way, saying, allow yourself to complete that experience for now. Now, some people are pretty good at coming back, but I might need to help, and so bringing them back to the shape of their body, letting yourself feel your body lying on that surface underneath you. So all of these things that are bringing them back to the room reality. And then we might talk a little bit. Actually, a lot of people just start talking. All right. And I should probably mention that during the session, I'm making notes all the way through the music listening. So it's a transcript.
Okay.
This is the other challenge of this approach is my attention is fairly divided, and yet I need to be present. So clients get a copy of the transcript of their music listening, their imagery, and that is crucial to this approach because it means you can go home and read this. And I have read transcripts from my sessions, and I've had the sensation of, who said that? That is so wise. And it's me. It's my psyche. So that tangible is very important. We may talk a little bit. However, we may move fairly quickly into drawing mandalas, drawing, art. And this is where the music improvisation can come in. So I have instruments in the room that I do sessions in.
Okay.
I have small instruments because I'm working with adults. I'm not working with children. So they're very beautiful instruments, different kinds of sounds and textures and colors. And so I might give somebody a choice. Is it a drawing day or a sound day, making sounds? So I might not even use the word improvisation because it's like,
sound
you want
mandalas.
me to, you want me to improvise. It's like, I don't improvise. It's like, I don't sing. So there might be some fear around that. There might be some fear around drawing too.
Right.
Yeah. So that is using the arts to process the experience.
Uh-huh.
And I wanted to share this example of a young woman, and she chose a drum, but it's also a tambourine.
Okay.
So it has a very beautiful drum timbre, but it has that tambourine.
Yes.
And she chose a mallet. I have different kinds of mallets.
Mm-hmm.
You know, different sounds.
Right.
Heavier, lighter. And I realized she was standing up and she was starting to improvise a healing song, like in the Aboriginal tradition.
Yeah, shamanic kind of.
Yeah.
Drum circle.
All right.
Drumming circle.
And so then I'm thinking, this is beautiful. I mean, she's following her own wisdom of what she needs to do to be with what she experienced in her imagery. What is my role? And my role was to witness that, to listen to that.
To fully accommodate it.
Yeah.
Mm-hmm.
She got up and she was in the room, and her voice was, this is not a trained voice, thankfully.
Yeah.
Because it was so strong, it's really coming from here.
Right.
And it was chanting. Now I videotape most of my sessions. It's because I work with a supervisor.
Right.
And so at one point, I thought she was going to ask me to turn the video camera off.
Uh-huh.
And I thought, okay, I'll need to honor that.
Okay.
And, it was so beautiful that, I maybe would want to listen to it again. She didn't ask me to turn it off. She said that I'm going to go into a healing song. I don't want your supervisor to listen to this. And I said, it will be so. Now, that's trust.
Yeah. Well, that's...
And she went into this healing song. Beautiful, beautiful song.
Mm-hmm.
And it was improvised.
Uh-huh.
But I wasn't improvising with her in terms of playing an instrument with her.
But you were present, which was part of the music.
And it flowed.
Oh, that's...
and that was beautiful.
Yeah, I have mentioned that.
Really, really meaningful.
I have mentioned that in my talks about conscious music, that the role the audience plays, or the role the listener plays, isn't necessarily just passive. They can be actively attentive.
Absolutely.
And accommodating, and maybe actually creating a sense of openness to take it to the most conscious level.
Yeah, openness. In psychotherapy, openness, yes, we might use the term container or containment. So containment in the sense of it's big enough to allow that, and yet it's not totally open. So it's a big enough container, but the point of it is not to close in or
not to
close
hinder
off
or obstruct whatever is going to come out.
Right.
So
because guided imagery in music, I've been using the word allowing. It's an allowing approach, and the other word is it's an uncovering approach. So that those images and the imagery, it's uncovering, kind of what we were talking about earlier, something that maybe we haven't allowed ourselves to feel or to look at or to experience or to process.
And when the session's over, what happens? I mean, when these music therapy programs go through from beginning to end, what happens? I mean, are there noticeable results in terms of people who come to you and work with you?
Yes. Yeah. Because one of the steps is, okay, this is happening in the session. So one of my questions, I don't always ask it. Sometimes what's happened in a session, especially a first session or a second one, I know that they're intrigued, it's important,
right?
So I might not be asking quite as many questions.
Okay.
Questions can be off-putting. But a question that I'll often ask is, okay, this happened.
Yes.
Do you have an idea of how this relates to your everyday life? Are there any connections between this and what's happening,
Okay.
in your day-to-day?
Okay.
All right.
Well, isn't that part of the whole thing, is to go as far out as you can, return safely and integrated back into your everyday walk?
And it can be every day, here and now. I had a recent session, and it's been a challenge working with this woman. She has a lot of anxiety and very much in her head. So part of my role as guide has been giving her some suggestions of what's happening in her imagery, which is really important, and helping her make the connections with her everyday life.
Okay.
All right. And an example of that is, it's maybe the third session, fourth, I don't remember. She had a very clear image of a brother who had drowned many, many years ago, 40 years ago, came into her imagery. And she was able to say things to him. She was able to tell him how much she loved him. So that there can be the exchange of messages to someone, and also messages someone that we need to hear. And afterwards, she said she had not been able to do that, tell him how much she loved him, because he died suddenly. It was a sudden drowning accident.
Right, and so we hold these projections of one another inside ourselves, and whatever state we left them off at is where they sit. You notice this, you haven't seen someone for 30 years, and yet you come back to this almost instantaneously to the same
and we can do
point
that in our
that
imagery.
you left off at. Whatever the attitude is,
right.
It stays put until you yourself can actively resolve it.
Yeah.
And that takes conscious effort.
Yes, and it was her.
Right.
It came from her, and the music. I fully believe she could not have done that without the music.
So
it allowed for that kind of loosening of the boundaries, loosening, so she could move, getting back to that cut log diagram. She could move back in time.
Right.
And also be in time, in her own
but
time.
she could be present here, but in that time frame as well. It's interesting, isn't it?
Yes, it is.
Because it seems to imply that what we are is not subject to time so much.
Yeah.
That all the times that we've experienced and lived are present now.
Yes.
And what are we going to do with it? And that's part of the integration process.
Yeah. And that's a simple example. I would, as a therapist, I would never say that anything can cure someone or totally resolve everything, but certainly can maybe shift something a little bit, make a little space for something else to come in. And that's kind of getting a bit vague, but I was actually just thinking of another woman I worked with. It was deep, deep grief. Again, grief. In the lingo, we call it complicated grief. It's grief that, the actual happening happened like 40, 45 years ago.
Right.
And it's still there, and it's affecting her everyday life. Mornings are still really, really hard.
Because of something that got imprinted essentially.
Yeah, it was a tragic loss in her life. And that was tough work, because the music opened and the mandalas opened, the drawing. There was fire involved.
Mm.
And I still remember this session where she's a little, didn't want to draw. I nudged her a little bit, you know, give it a try. She started drawing and she drew the fire.
Mm.
Intense. And because art, compared to music, art, you know, visual, it's tangible. And she said that's the fire.
Right.
So there is the potential healing, and yet terrifying, and also a great source of anger to her, because it took someone away from her that she deeply loved.
Mm-hmm.
Yeah, so that's intense.
Well,
but could we have gotten there with, so, how's it going? And, yeah, this happened 40 years ago, and, you know.
Right, it's not just in the words, but it's in the cells themselves.
Mm-hmm.
The memories retained.
She took herself there. She didn't want to go there, and yet she does. You know, she's on a journey. She's on a journey.
So, I mean, what is the, I wouldn't say hope, but what is the aim, ultimately, when working with someone who's that deeply traumatized? How does one coming
to some peace?
Yeah,
that was her aim.
As a therapist, though, or as a practitioner.
My aim for her, I think, was similar, to come to some peace around that, and that the person she had lost would always be with her. And also an aim with her was to allow her to release some of the anger, and that did happen. That was tough work, because, I mean, this is getting into another direction, but where somebody directs their strong feelings can actually go into the music and the imagery. Mm-hmm. It's the power of the method.
Yeah.
But it can actually come directly to me. And in this case, it was directly to me. So it was a huge learning for me in how to be with someone that is just purely in rage about what happened.
Well, that's
still after so many years.
It's to be present for it, but not to take it on.
Yeah, so that's why it's good for me to have both a supervisor who is accompanying me through my clinical work, but also I have my own therapist.
Interesting. Well, yeah, I've heard of that because we need to help. The healers need not to get sick from
that's right.
the diseases of the patients, and that's especially with mental emotional things. It's not as tangible as physical, but it can be just as powerful. Mm-hmm. So we need, the healers need to be able to transform whatever the energies are, and to understand what those energies are that are being released during the sessions.
Try to understand.
Well,
sometimes be confused. But yeah, I'm agreeing, and simply is if I am not on my own journey, trying to follow my own path, then how can I be there for someone else?
Right. Well,
how can I really be present there?
I suppose you would have to have navigated those waters yourself, within yourself, in order
maybe
to
different waters, but yeah, definitely. Yeah.
Same river, different day.
Yeah, that's right. So, for that person, I mean, my aim was to be there for her, with her. Those are kind of cliche terms, but really, really, to be there, because nowhere else in her life could she express so raw those feelings.
Okay.
and you know, I mean, when the emotions are coming out and they are raw, very, very few places in our lives, very, very few people can actually stay present to that and
Correct.
guide somebody through
Correct.
that. And then I knew I had the music. Now, again, I'm going on, and maybe we're sort of coming to the end here, but there was a point that she actually became quite afraid of the music.
Because she associated it with the release of these...
She knew how much what it was opening for her.
Right.
So there was at least one session where we did not have music, and it was she cried, she sobbed, deep, gut-wrenching sobbing. Yeah.
Mm. But if that's in us, it's just like something that's festering for, until we release it.
Yeah.
And then once it's released, and hopefully not just released, but transformed.
That's right. Released, transformed, making sense of it. So that's where the mind comes in, and that's why that post-talk after the music is very important.
Mm-hmm.
And also if we have several sessions, coming back to things, getting all those pieces together. And our mind, our intellect is part of that, what we've actually experienced. Mm-hmm. And it's important for me to not lay on a lot of interpretations of what it means for somebody else.
Right.
I might help by suggesting something, because sometimes I need that.
Mm-hmm.
I don't know. Well, it might.
Mm-hmm.
But the true transformation comes from within, in terms of what does that mean? What does that image mean for myself now in my life?
And has that become integrated into the bigger picture of one's life, right?
That's right. That's right. And an example of integration, because it's a really big concept. Oh yes, well, we integrate, but what does that mean? An example of that might be if someone is working on anger, and the way it's coming out in their everyday life is things really irritate them. Just little things, just really irritates me when I have to, I'm not speaking personally, it's just an example. I have to wait in the bank, it's like, or because I live in an area where like if I go into Toronto, it's like road rage, those little irritations. So what are the source of that? Because it's not just that somebody's stressed out and that they're having a bad day, and there's an awful lot going on, if they got a lot of worries. Something really deep that's...
They were neglected, maybe, at some point?
Something, and it's playing out in these irritations. And then I have a woman that will say to me, this is not the kind of person I want to be. I don't want to be irritable with my partner.
Mm-hmm.
And what's this about?
Well, when you
and
find
if they
the real
start
reason.
reaching those sources in the session, then little by little, they start changing or becoming the kind of person they'd like to be. Little bit. And then that might mean this kind of feeling of irritation just starts softening.
Yeah.
Like, this is not really this important.
Right, or one
So
becomes...
So that connection between our day-to-day life and what's happening in this incredible imaginal world, that is important. And as a therapist, I keep an eye on that. Because we live in these different worlds.
It seems like it's like a vast ocean that you're just coming to the shore of at this point with the music therapy. Because it seems to me that when you look at humanity as a whole, the human race on this planet, I think the reason that things are the way they are now is based on a lot of things not being resolved by individuals, between individuals and between groups and the totality of our humanity. And so these kinds of attempts to address the you might say, the dysfunctions in us to allow us to function more completely.
Right.
This work is just at its beginning, I think. The sound of it.
Yeah, it is. It's not that I totally agree with everything that Carl Jung stated in his theories, but one thing comes to mind based on what you're saying, and he had a deep, well, he was a very introspective person. He had a deep, deep belief that with the collective, that if we didn't on an individual basis start working with ourselves, on ourselves, that humanity
would be consumed by its own shadow. Would be consumed by its own shadow.
And that it was that, step by step,
and
each of us trying to do what we can.
Well, obviously, we're very grateful that you're doing what you're doing, Carolyn, because
thank you.
Yeah, because it's true. This music therapy is just beginning. With only like 6 places in Canada. I don't know how many in the States, but it's
more. And Europe, I should say. I mean, it's an international field.
It's
I haven't given you the sort of the professional piece of things. Perhaps,
but the point is that this is a growing field. That those who are interested in helping with the human condition, as it were, would certainly find music therapy to be of great interest.
I think so. I mean, it's. I feel so blessed that I can work and play in music therapy. I mean, how many people can work and play and grow in their career, and in their job, and what I learn from the people I work with, and that includes students.
Right.
Incredible. And I also surprised myself that I became a music therapist because I am introspective. And here I am in a field where I'm out there. I mean, I'm in there and out there with people. And wow.
Well, yeah, it is wonderful when we can actually work at something and have fun doing it as well.
Yeah.
Nice choice.
Yeah. So thank you for your questions.
Well, thank you. Thank you. It's been lovely.
Thanks, fun.
Yay. Okay, well, thank you. That's it.
Thank you.
And thank you for watching.
All right.
And that's it.
All right.
All right. Now we can get up and do whatever.
Okay.